Recently, there are new guidelines for colon and rectal cancer screening, and that includes patients who are over the age of 45. This is very important because we're seeing colon and rectal cancers in younger patients. It used to be that if a patient was very young and they came in with a certain complaint, we wouldn't generally jump to doing a colonoscopy. However, nowadays we generally do take those complaints very seriously and investigate with a colonoscopy. There are several different types of screening modalities, but colonoscopy is still the gold standard. Usually with a colonoscopy, the biggest fear on the patient's part is the bowel preparation that happens the day before. It isn't even the procedure that worries them. So generally what I do in my office is try to identify what the barrier is if the patient is hesitant to proceed with the procedure. And if I can alleviate some of that fear, generally patients are open to doing it. Colonoscopies have allowed us to be able to detect colon and rectal cancers and polyps much earlier than before. Many times we're able to treat these polyps and cancers with just the colonoscopy rather than needing surgery. In some cases, surgery is still needed, but in those cases, if we can catch the cancer early enough, the patient may not require chemotherapy afterwards. If you were to screen patients over 50, about a third of patients would have polyps, and a lot of the time these polyps do not cause any symptoms until they've progressed. So colonoscopies have really changed the way that we're able to treat colon and rectal cancers. Polyps are generally precancerous. There are times where you can have a cancer in a polyp, but most of the time these are what we call benign lesions that several years from then could cause or turn into a colon cancer. If you are to have a polyp at a colonoscopy, then we would then recommend screening every 5 years or even sooner than that, depending on the number and the size of the polyps. There are several different types of hereditary disorders when it comes to colon and rectal cancers that may alter the age at which you start getting a colonoscopy and the frequency that you need a colonoscopy, because sometimes those cancers are faster forming and more aggressive. So we always have to ask our patients if they have a family history of colon and rectal cancer.